Good evening, all. Welcome to today's discussion. I would like to convey my sincere thanks to our Father Salim and all admin panel members for this wonderful opportunity. And my special thanks to Arya ma'am. And now it's about early morning 3:30 for her. Still, she didn't sleep. So thank you for your present and constant support to our platform. Without much introduction, we shall move on to our today's discussion. So I will be coordinating the discussion. Manju will be doing this introduction part. Minnie Jackson, Nitya, Shali, and Anit will be discussing the questions. So first, I would like to call upon Manju to present her part. Manju, you can continue with discussion. Introduction.
Okay, sir. Okay, thank you. First of all, good evening all. My name is Manju Shibu. I am a member of the admin panel. First of all, I would like to say my sincere thanks to our mentor, Dr. Father Salim Joseph, our chief admin, Soumya ma'am, Arya ma'am, and other admin panel for giving me this wonderful opportunity. I am so happy because many aspirants are learning from our Edu Skills platform because this Edu Skills international platform is a free platform. Today, I will do the introduction part. In the listening module, we have 3 parts. 42 questions will be there. For B grade, we have to correct at least 32 question answer. Always father will advise to aim for grade A because when we are aiming for grade A, surely we can achieve at least grade B. Always keep in mind when we are following father's strategies and tips, I can assure that you will get your achieve score. In the first A part, we will get 2 consultation. We have noticed whom is talking, maybe neurologist or cardiologist is talking with the patient. Each extra 5 minutes. Then when we are getting the booklet, that day we have to read all the headings, subheading. Then when we will get 30 golden second. That time we use it properly. We read all the heading, subheading. If you notice any medical condition, just underline that. And whenever we are listening the audio clip, listen what the patient is telling. That is very important. Then we have to fill the notes with a word or short phrase. We know the so many medical names, but we we don't paraphrase it in that. What we are hearing the audio, that same word you have to write it. Then next, when we are listening the part A, what all things we have to listen. Sometimes they will use some body part or synonyms or negative expression or what all things we have to look in that. Then next we can move to the listening strategies. In the listening, one main thing is prediction, because when we are reading the heading, we will get some idea that the cardiologist is talking to the patient. We can predict some answer. Maybe patient have some chest complaint or some difficulties related to the heart problem. What the test they are planning, some prediction we can do it. Next is beware of paraphrasing. Paraphrasing is very important in reading and listening module. Then we aware of synonyms. We can some same meaning word we will get. So we aware about that synonyms. Then collective words. Maybe they will use some bird example like birds or some collective words also. We just look into that. Next, listening for important things. What all things we have to listen? Mainly body parts. In the audio, patient is telling the patient having some pain on the chest or a pain in his knees. We have to listen. Why that patient is used plural or singular. That is very important. Then adjectives. Patient is telling patient having severe headache. So severe is adjective. These are very important. Next is name, medical condition or medicine. In the audio clip, patient is telling some use past medicines or patient had some difficulties or some condition. That is very important. Then symptoms, example like headache or abdomen pain. These are very important. Negative expression sequence, example like firstly, lastly, or secondly. Then patient is telling any complaint or something that is very important. Seventh is cause and habit. Impact of medication. Earlier patient is used some medication. That time patient occurred some allergy or something. These are, we look into that. ET is procedure. Is they are planning to do some ECG or X-ray. When we are reading the booklet, that time we mark into that what all the important. We underline that. When listening the audio, we can write it properly. Same word we have to use it. Then information or daily activities. In that we can look into that. Patient is able to do some daily activities, or patient have bedridden, or these are we noticed. Then perception also is very important. That's all. Thank you.
Okay, thank you, Manju, for your great explanation. You have mentioned the strategies and how we can predict, how we can assume the answers. So, thank you. So now I would like to call upon Minnie Jackson to present question number 1, 2, and 3. So in listening part, in the first section, there will be 12 questions. So in our listening part A discussion, we are discussing only 12 questions. So the first 3 questions will be discussed by Minnie Jackson. Please, Minnie.
Good evening, Father and admin, and all the aspirant who is watching me now. And I am Edu Jackson, one of the OET aspirant in the Edu Skills. And I would like to express my gratitude from the bottom of my heart. I need to say the thanks to all the members who is given the opportunity to participate in this discussion group. Then we will go on to move to the next portion, that is a question portion 1 to 3. I will go into discuss. Okay. Then first of all, whenever we'll going to start the questions, we need to focus some important things. Okay. Then already ma'am told that what are the important things: a scale, model verb, the sequential expressions, adjectives. These all the things. Okay, we need to focus more. Then while starting the extract one, we will go to hear that context. They will go on to say something about the introduction portion. Okay, that is a physiotherapist or a cardiologist, something like that, or a physician is talking to the patient. Okay, so here we can understand that who will going to talk with, that is the who or whom. Okay, that is the two person is there. The physiotherapist is going to talk with the person. Today's our topic is the patient name is Ray Zanitz. Okay, so patient name Ray Zanitz, and who is going to talk, that is a physiotherapist. Okay, so then we need to focus the context what they will going to talk. So according to the context where we can understand that what is the answer will comes in between. Okay, after the in between the 12 questions, we can predict that answer what they will going to talk. See, then we'll come to the questions. Here it's mentioned that the patient name. Then it's shown that 18 months ago, back injury sustained. That is in the bracket. It's given lifting and the question number 1. So what we will going to predict here? Okay, we need to understand that the patient has maybe something they lifted or moved from the one side to the other side. Okay, this is the only prediction. We doesn't know what is the exact weight there, but while listening to the audio, we can able to understand that what was the things. But we got some idea about that something he lifted. Then while talking to the physiotherapist, he's telling that 1 year ago he had the problem with the sciatica. I hope you all people know about the sciatica means what is that. That is a commonly we can say that this is the back pain will be radiated. That is the from the lower part will go into at the pain and radiate into the other portions in the down areas. Okay, in the leg, maybe in the one leg or maybe in the two leg can occur. Okay, that is according to the patient condition only. Then Again, after 6 months, 6 months ago, clear of the symptoms. He got the clear the symptoms with the help of the medication or some other treatment. Then last month, he got the reoccurrence of the symptoms. Reoccurrence means what is that? It's again it's occurring. Okay, symptoms is again is occurring. Already it was substate, but again after 6 months or last month, they it came back to the same symptoms and he is getting pain more. So that's why he came to see the physiotherapist. Then second part, that is a patient description of the symptoms. Whenever we'll going to use the 30 second, we need to focus on the left side of the headings of the, that is the subheadings is given like a patient history or patient description of the symptoms. Okay, whatever the things is given as a subheading, we need to focus according to that only. They will go into give the questions. Okay, then here next question is the pain located in. So as we know that located means something, okay, that is going to be in the body part. Okay, because it's a patient have the back pain or a sciatica is there, so definitely some area of the body parts we need to predict that. Okay, then next one is the pain described as. Described means that is the nature of the pain or how it is affecting, okay, or how the feelings of the patient. Patient maybe is getting the mild pain or moderate pain or severe pain or intense pain or when they couldn't control, okay, in a uncontrolled pain. That means it's a described as pain, how it will be. Okay, that means affecting the patient, how he's getting the pain. Okay, and then we'll move to the script, how they given in the script. Okay, this is the way they will going to talk in the audio, and you will also listen the same things. But don't think that the same word we will going to get it on the question paper. We have to predict or we will go. We need to get the synonyms of the words. Okay, maybe they are using the same meaning, but it will be different. The words will be given in the plate. Okay, see here, this is a paragraph base I give. For better understanding, I divide the top the portion with the two. Okay, this is a physiotherapist and resonance talk. Okay, the physiotherapist is going to talk with the comment that is from the starting. This is the way. Okay, how they are telling that. Then come to the third line. Okay, is telling that patient is telling that, well, it all started when I hurt my back, okay, about 18 months ago. This is a question we had, okay, that is 18 months ago. Now I was giving somebody a hand of heavy suitcase. So the answer will be a heavy suitcase. So already we predict that the something he lifted, but they are telling here is mentioned that I was giving the hand to someone. Okay, that means he's helping to the some person to lift the suitcase. So you can write the word exactly the word a heavy suitcase. The heavy, a heavy, a heavy means that is the adjective is there because it's for the suitcase. Maybe it's a lightweight, or maybe heavy. Okay, so he's telling that with the heavy suitcase I lifted, that's why I got the pain again. Okay. Then next here again the GP is asking that the physiotherapist is asking the many questions to him. Then he's telling that where I have the pain, that means in my right leg. Okay, either the right leg, right means that is the adjective is here. He is mentioning that my right leg in the audio. You can write the right leg. Then come to the next point, that is the third question. He is telling that I have the pain, that is a really intense pain, that is the nature of the pain. He is describing how he is getting.
Thank you, Minnie.
Thank you, ma'am.
It's a wonderful explanation from your side. So we have understood everything, each and every point you have highlighted. So your PPTs were very nice, and I know you are good at making PPTs. you have done it before also. I appreciate your willingness and great mind to spend time with us. Oh, so thank you, Minnie. Next is Nitya. She will be presenting the question number 4, 5, and 6.
Firstly, thank you, ma'am, for this opportunity. Okay, good evening, all. My name is Nitya Binil. I am one of the OET aspirants from Edu Skills International. I would like to thanks Father Salim Joseph for this wonderful opportunity to participate. We know this week we are completely discussing listening part A. My job is to dealing in the question number 4, 5, 6. Okay, I think all of you have these questions 4, 5, 6. Okay, I am going to deal with these questions. And in this question, the recent patient explain the symptoms. And based on the symptoms that questions are dealing, that is the fourth question is mention the inability to dash as most frustrating aspect. Father already taught us how to deal with these questions. First of all, we have to foresee the question. Prior to answering the question, we have to foresee. In this question, they are telling mention the inability to dash as most frustrating aspect. The keywords are inability. So we have to, whenever we find the question, that means that in that 30 seconds, we have to underline the keyword that is inability. Then we have to foresee which will be the answer we have to assume. And this patient is exactly telling he is having sciatica, that is the disorder he is having. So we have to assume the symptoms related to that. That means he might have some difficulties in sit or walk or whatever may be. Then we have to underline the inability, the word inability. And the remaining part we have to focus because they are giving us most frustrating aspect. So we can assume maybe he has some problems more than one. We can assume like that. But or maybe we have to underline the inability, the first keyword inability, and the next keyword as most frustrating aspect. And we have underline and we have to keep it in our mind. Then in the next question, the fifth question is dash sensation. These all are Raisan describing his symptoms. So we can assume that he might have some problem, sensation problem. So we can just assume whatever in our mind we have just assume. And in the bracket also they have something written that is cows. Okay, we have to keep in our mind also cows. Okay, then we have to move on the next question. The next question is not related to symptom. So we have to change our mindset and we have to focus on the occupation and read the question and underline the word occupation, keyword occupation, and next to the question part, that is the dash in the bracket they are written involves travel or some manual work. Then we have to underline travel or manual work because the occupation involves this matter. So we have to assume that also. So we have to keep these things in our mind. And when we go to the script part, in the script part, we have to focus on the scale expression and negative expression, adjectives and synonyms language. We have to remind all these things in our mind while listening the audio. Then now I am reading the part just relating to the question number 4. In this race and telling, I mean to the extent that I couldn't stand for very long, couldn't walk hardly any distance. I couldn't sleep. The most frustrating bit for me was that I couldn't turn over in bed. It just hurt so much. From this, I could understand, and he has the problem in walking, standing, and sleep. But in the sleep, they are again stress. The most frustrating bit for me was the sleep. And he is telling like that. Our question is mentioned in the inability to as most frustrating aspect. And we already underlined in the hedging word in the inability and most frustrating aspect. The synonym of the inability is the couldn't. Okay, we could locate the word couldn't in the script. So we can identify this might be the answer. Sleep is the answer. Then we want to again confirm because he has more than one problem inability. So he is also telling the most frustrating bit is the sleep. So from this two aspects, the couldn't and most frustrating bit, we can the synonym phrases are, so we can understand the answer is sleep. The again portion also, he is telling the expression such as so much. We from these things we can understand the answer is sleep. Then when we move to the next portion, that is the question is dash sensation, and I am going to read that portion. I couldn't get comfortable. Do you know what I mean? Sometimes I would have a sort of tingling feeling in my calves as well. But then at other times, my whole leg just felt a bit numb, really. Then in this script, and we have to locate the synonym of sensation. He is telling instead of sensation, feeling. Then cause also he is telling. Then we can locate the adjective of the feeling is tingling. Then we can identify the particular answer is tingling. Okay, then just near to the answer, he is telling but. There is a contrast word but also there. Then we can almostly confirm if the answer is tingling. Then the next question is side heading is occupation. Then dash involves travel or manual work. Then he is telling something related to his occupation, and if this occupation involves travel and manual work. Then I am going to read that portion also. I couldn't go to work. That the exact synonym of occupation is work. Then he is telling, I am an event organizer. I travel a lot. Then in our question, bracket is telling travel or manual work. Then in that script, he is telling, I am an event organizer, so I travel about a lot. Then the correct synonym of the travel is there. Then the one scale expression also he is telling a lot. From this aspect, we can understand that the answer is event organizer. Then from this script, I understood the synonyms words are inability, synonym is couldn't. The most frustrating aspect is the most frustrating bit, sensation, feeling, occupation, work. As father already taught how is the strategies like time expression. In the script, the time expression is very long, then contrast word is but, and the scale expression most, so much, and the negative expression couldn't, hardly. I hope all you understood this explanation. Thank you, ma'am.
Nitya,
Thank
it's
you,
very
everyone.
wonderful, dear. Yeah, you did it very well. We all understood your all the strategies. Thank you, Nitya. So next, I would like to call upon Shali to present your part. Welcome, Shali.
Thank you. Good evening to all. My name is Shali Thomas, an OET aspirant from Edu Skills International. I would like to thank for Father Salim, Joseph, and all admin members. Thank you for the opportunities. Today, I am going to present listening part A, question number 7 to 9. Before starting the audio, we allowed it to 30 seconds to read the question and understand the keywords and predict the answer. My question is 7. The physiotherapist asking, how was this treated? In the question, we can see here initial treatment, prescribed NSAIDs. They asking for some application. We can predict the answer, some application like a hot water and cold water like it. Then the 8th question, they asking for some referrals, and we can predict an osteopath or any like the answer is osteopath, but we can predict some answer. In the 9th question here, further treatment, epidural injection. We can predict some answer for the before hearing the audio. In the test, the physiotherapist asking for how was this treated. They asking, I'm going to read the test. Here, in the first instance, I was given the painkiller obesity, ibuprofen. As far as I remember, I was told to put some compression pack on the affected area. In the question, we can see there is an asking for some application. The answer is compression packs on the affected area. Here, they're using some synonymous language like application in the question. In the audio, the patient telling in the put compression packs on the affected area. Then we can carefully listening the audio. They're using some synonymous language on the question and audios. And the eighth question is referrals. The referrals referrals in the question, they're asking for referrals in the test, in the audio. Then the GP sent me to see an osteopath and I got some treatment there. But it did not seem to make much difference. So I was referred to a sports injury specialist of all things. And he told a number of things that did seem to see things a little like working in my spine and lower legs. We can see in the question, they asking for the referrals. In the audio, they use some synonymous language referral. In the audio, they saying, then the GP sent me to use the osteopath. Then we can see in the they use for the synonymous language and the model verb, but they use in the 8th question. In the 9th question, further treatment. They ask further treatment. In the question, in the audio, any other treatment. Here in the test, in the audio, almost I forgot there was the course of ingestion, and I went for the various other therapies like ultrasound and another one where they do. And here we can see in the synonymous language further treatment in the question. In the audio, you can see in the any other treatment. Then when we are listening the part A, we need to carefully listen the audio. They're using the synonymous language in the question and audios. Once we completed the audio, when you're practicing the listening, once you completed the audio, we check the answer with answer key, then identify the mistake. Again, you can go for the audio with the script, check how to pronounce the answers. This way, we can improve the listening part A. Thank you.
Thank you, Shali. It's a
Sorry.
wonderful explanation. Anet,
First
I
of all-
welcome you to present the last 3 questions, Anet. Welcome.
Thank you, ma'am. First of all, I would like to say my sincere thanks to Father Salim Joseph and all admin panel members for giving this opportunity to share my learning experience with you all. Today, I am going to discuss about question number 10, 11, and 12. Question number 10 and 11 comes under further treatment, and question number 12 comes under previous diagnosis. First, question number 10, decided not to try. So we have to listen for some treatment because it comes under treatment. So there will be some treatment. From the script, we can identify that from the physiotherapist asked any other treatment. Any other treatment means it's a synonymous language of further treatment. From the patient side, we can see that at one point, I even considered acupuncture, but by then the other things were beginning to take effect and the symptoms were subsiding, so I gave it a miss. Here, but is the contrast word is used just after the answer. And after this contrast word, we can identify the reason why the patient decide not to try. Here explained other things means other treatments were beginning to take effect and the symptoms were subsided. So the patient decided not to try acupuncture. So here the strategies but contrast word is used here. Then question number 11, patient attributes recovery to. So here also we have to listen for the some kind of treatments because it also comes under further treatment. In the script, we can see that from the physiotherapist asked, so which of these various treatment do you feel was most effective? What made the differences? From the patient side, we can see that, well, I couldn't say for certain because it all went on for 4 months without much improvement really. Then it wasn't until suddenly in the 5th month, things changed quite dramatically. So to be honest with you, I think it was a combination of treatments gradually taking effect and coming together rather than one single thing making the differences. So here the answer is combination of treatment. As our father taught, after this, there are some 10 clues. If there is any adjectives, after that you will get the answer. So here the adjectives is honest. So after that, we can see the answer combination of treatments. And also in the physiotherapy section, we can see that most is the scale is used here. The next question, 12, previous diagnosis. Sciatica probably related to dash. So we have to assume there will be some diagnosis. So we have to listen for that. And also here we can see the word probably. That is used for speculation. That means speaking about the future or uncertain things. Physiotherapist, in this section we can see that physiotherapists ask, did anyone ever talk to you about what might be causing the problem? And the patient said, well, I think everyone assumed that a slip disc was behind it all, but this was never actually confirmed as that. So here the answer is slip disc. Assumed and never actually confirmed is the synonyms languages of probably. So I hope it's clear to you. Thank you. Happy learning.
Thank you, Annette.
Probably is your opinion word. Yeah, might is model verb. No issues. But great presentations. I loved it. Yeah. Wonderful presentations. You did, you all did better than me.
No, Father, not
explaining. Yeah, definitely, yes. I stopped at one of the restaurants. I'm in a long journey of 400 kilometers. I stopped and borrowed some internet from restaurant wala. I connected.
Thank you so much, Father, for your valuable time with us.
Their experience. Yeah, Savita, please continue. Sorry for the interruption.
The point that I am saying, Father, when we are doing, we know the real struggle, what we are going to expect. So that is our point of view. We are explaining to others means they'll definitely get the benefit of that. That is they are did very beautifully, Father.
Yes, that's really great. And you know, the clarity you get when you teach at least a couple of the questions, that's the great. And you will never get that clarity even if you practice 50 times. Teaching once is like practicing 50 times. I hope those who taught today, discussed today, might have had that experience because you dig deep into it, try to clarify everything.
That's going to be remembered for the lifetime, Father.
Father, my first experience this.
But you did very cool and very beautiful.
Thank you, Father. Thank you.
Yeah, I was listening. I actually wanted to attend, so I got into it's inside a big forest I'm traveling, but there is a small restaurant, so I just got into and borrowed their internet. Otherwise, we don't have almost 100 kilometers. We don't have network here. It's a forest.
Thank you, Father. Thank you.
Yeah, nice. Thank you. Congratulations for taking up this initiative.
Because every one sentence we're going to check the meaning. When we presenting to a public platform, we need to check every one single word also we need to check the meaning. What is that? What is this? Whether I am telling wrong or like.
And that's the real learning. Okay. Otherwise, you won't take that much strain to learn. Then only, and with this, you will improve your competency. Not only that, don't worry about the mistake. Maybe sometimes it happens when you speak, when you continuously go on explaining, sometimes your mind will slip. And even if you make a mistake, no issues. You are all learners.
Thank you.
So that's great. Yeah. Arya ma'am is somewhere morning 3:30 or 4 o'clock.
It's 4:30. I didn't sleep actually.
Yeah, Arya ma'am did not sleep she was waiting till now because I am traveling. I didn't know whether I'll have network.
Good evening, Father.
Yes, good evening.
I'm Nitya, Father.
Yeah, Nitya, I know. I was listening to you. Great presentation. Nice presentation.
Okay,
You're like an expert person.
No, thank you. That's not good because I don't know how to present all these things. The first thing is I watched Father's video and I could identify all the strategies and I tried to present whatever Father told in that video. I find to search and what all the aspect in this particular script and I try to find out and I present it.
You did it very well, very well. Then this is a great learning. There's a little risk and you'll be a little frightened, but there's a great learning. Not only that, you need a lot of confidence when you go for the exams. I tell you, more than 50% lose their scores because they are frightened of the exam. They are not confident when they go there. So you need competency, confidence, and God's grace. All these things equally you require. Only merely with competency, when you go there, you will start shivering and you will start mumbling, like, no, you will not be able to read, listen, and all those things. So these all three aspects you have to get trained. That's why we give you all these chances.
Okay, thank you for
Yeah.
But honestly, it was helpful for me. And a lot of time I took and I sit, I read and I understood. And I would each line I learned and I prepared.
Yes,
Thank
you
for
did
this.
it. Yeah, did it very well, very well. All of you did very well today. Grand it was. It was the first initiative in the platform, and you'll remember beginning this initiative. So far, the discussion was in Telegram. I thought maybe a visual discussion will help you more. That will make you more confident, and also people will understand better. And next time, I'll give you all the PPTs. I have almost every PPT about every subject, so every material. So I can give you the PPT because these days I was out of station. I could not connect. Cool. Anyhow, congratulations. And many I know you will do. Yeah. Even other people also, like I have seen them in the classrooms doing it good. Waste model.
Thank you, Father. Thank you, Father.
Thank you, Father. Okay, I'll explain the strategies. And gradually, I'll ask you when you give the feedback, when you give me which are the questions you make a mistake, then we understand what strategy is problem for you. So we'll explain that particular strategy and what is the trick played there. There are certain tricks behind every question. They are called strategies, and people call it tips. They are not actually tips, they are strategies, official strategies. That will handle and keep a record of your mistakes, in which material, which questions. Okay. Yeah, and if at all you can take a screenshot of that question and that particular text, or if you are good at PPT, you can just copy that question and text in a PPT and send me so that I can explain it.
Whenever I'm getting the answer wrong, after checking the answer, then I'll come back. Okay, I'll go back to and I watch the father's video also. And it's getting more ideas.
Yeah. And also please forward those session 1 video to all the people possible, because if everybody starts with that session, I can guide them step by step clearly. So first time we are trying to organize the videos, session 1, session 2, like till session 40, 50, continuously into small videos, so that anybody who comes, we can understand, okay, start from the session 1. Because the common complaint was that we don't know which video we have to start with. So that complaint we are to, but it takes a lot of struggle to edit it and present it in that way. Still, we thought we'll do it. But then what I want, this video has to go at least to 5,000 people within a day. So share it maximum. So whoever is like, if they start now, they will not be confused. After 10 days, if they start, they will have to watch all the 11 videos in one day, which is not possible.
Yes, Father. Yes, Father. We'll do it.
Because if they all join, it's easy for them, because many get confused where to start. There's a common question I get. We don't know which video to watch first. Where should I watch first? Could you send it as per an order? It's not possible, you see. Now we will post it, and regularly we make a list of all those videos, 1 to 10 or 1 to 20, 1 to 30, 1 to 40, 1 to 50. At least some 100 videos might be there, small videos or 4 subtests. Anit Jose, your presentation was great, like a super teacher. Good. You look and you are a mature teacher. Good. Great.
It was very useful, Father, because I watched your videos and make notes. Then I prepared everything. Then I practice many times here.
No, that's the real practice we require. No, it's not practicing many materials. Same material, go deep, understand. That's the competency, real competency. That happens only when you participate in such things. And all those who are here, please repost the video, today's session 1 video, and reach it to maximum and ask them to watch it and make notes. And most of the doubts are clarified in that particular video. Doubts regarding how to answer in the reading part A. I will send some of the introduction videos in the beginning, some tips and other things. Then we will go 4, 5, 6, 7, 8, 9, 10, something like that, the A part videos. Then we'll go into B, then we'll go into C, the same method. So the reading as such will have around 40 videos, I believe, small videos like today's 10 minutes. And ask them to also encourage them to write down the notes. That is must, otherwise they will not understand.
Yes,
Yeah.
Father.
And today, as I was traveling and thinking about your discussion, I was thinking this is your own medical subjects. And you require this for your life. Why don't you do research and get experts into these subjects as such? Not only language, even the topics. That will definitely help you, because I've seen my students going abroad and doing PhD. Even our own OET students from this platform, there are some who have got PhD and they are posted in high level. Like recently, one is appointed as teacher. I think maybe 6 times more salary than a nurse, registered nurse. One who passed from this platform, she has become a doctor. PhD, and she's teaching now in the university now. There are many.
Actually, reading section, I attended the very beginning, 2 sections only. After that, I couldn't attend anything because I was on vacation. I was in India, and now I came back, joined duty. And so I was so unhappy. I was disappointed that I missed all the reading session. But suddenly got the good news that we restarted the reading section.
You can
And
go with
so-
that.
so
Go
happy
according
and-
to that step. Yeah. Do those steps,
Thank
sessions, clearly follow them. Additionally, you can do listening, reading, whatever if you have time. But make sure that the session 1, session 2 videos which you are uploading, make it thorough. That will be more than
yes,
enough.
yes. Okay, Father. While seeing you, I feel relaxed.
Okay, God bless. God bless.
while going on this discussion, I was afraid. I was terrified. These people are so happy, they're relaxed. I'm under pressure.
And come on, participate,
Well,
and you will
seeing-
become confident and happy. That's a different joy. All these people are afraid, and they were afraid, but they become very confident and competent as they start discussing. Just to encourage you all, I stopped in between this journey. I never knew I will get a connection, but the restaurant people were generous to give me Wi-Fi connection.
Thank God and thanks to you.
Yes. So don't worry, Ma. You can go on. What I say, you must do the session 1 video, watch it, write down the notes, and follow it up with the task. Then other things you can do if you have time. This one discussion you can follow. Maybe when it is uploaded, you can watch the video as well. No problem.
Actually, I already started watching our previous January videos from the beginning. Then suddenly you announced this happiness.
Yeah. And see that this happiness at least goes to 10 people in your contacts. So that they join from the beginning. That will help you. God will bless you for that. Yeah. Because when we are struggling, even animator, this one, admins, and so many people, volunteers are struggling so much. Their efforts should be fruitful. It should reach maximum people. That's what we wish. Yeah.
Sure, Father. Sure.
Yeah.
Thank you.
Welcome. Yes. And appreciation, everybody. Okay. With all those who presented, even Manju, I heard she was doing good introduction part. Yeah. Everybody did it well.
No, Father,
Anit?
because of your videos only we learned this much.
Anit, you are very confident and mature. Presentation was I loved it. Yeah.
Thank you, Father.
And when you are presenting, I got some idea how to edit this. Some new thing. Yeah.
Father, thank you for your valuable time, Arya ma'am. We know we took your sleeping time. Sorry, ma'am.
It's okay.
And all the participants, my sincere thanks to you all.
Okay, bye-bye everybody. Going good. Great. God bless you all.
Thank you, Father. Thank you, Arya ma'am.
Yeah.
Thank you,
Thank you all.
Yes.